I'm Katharine McIntosh. I'm Head of Research and Policy at Cardiomyopathy UK. I'm hosting on behalf of Cardiomyopathy UK. And I have got a bit of a background in mental health myself. I was a trustee for many years for a Mind Association, and my most recent job was actually with the Royal College of Psychiatrists. So it's a topic of particular interest to me. But we've got a real expert with us today in Andy Bell. Andy, do you want to introduce yourself to everybody?
Thanks, Catherine. Lovely to be here. My name is Andy. I work at Centre for Mental Health. We're a independent charity. We've been around for a number of years, and our work is all about building evidence and research in order to tackle inequalities in mental health and well-being for the whole population. And one of our areas of focus is the overlaps between mental and physical health. So really delighted to be here with you today.
Thanks, Andy. And just in terms of what we're going to be covering during our chat this morning, first we're going to talk about what mental health is, then we'll move on to talking about the need for more mental health support, and then in particular, what changes are needed to improve mental health care for people with cardiomyopathy. And then we'll have our Q&A at the end. So without further ado, we shall start it properly. What is mental health? Andy, what does mental health mean?
It's a fascinating term, isn't it? We use it really loosely, but actually what we really mean by it is fascinating. And of course, to all of us, it means very different things. The World Health Organization talks about it as being a complete state of social, emotional, and psychological well-being. So in some ways, mental health is just a flip side to physical health, but it's the psychological and emotional parts. And we know that it's something we've all got from the day we're born through the whole of our lives. We all have mental health. Some people have good mental health, some people not so much. We like to think of it as a bit of a spectrum. If you can imagine a spectrum going from green through to red, we're all of that somewhere every day of our lives, and we'll all move up and down it. We know at any one time around about 1 in 4 of the population has poor mental health, so what you might call a mental health problem, or in some cases mental illness. And over the course of our lives, that means most of us will at some point experience a mental health difficulty of some description. So it's about a state of being, really. It's about understanding that mental health is just a natural part of life. And for many people, unfortunately, mental health is bad enough that you could describe it as mental ill health. And that's when people may need support for that, in the same way as you need support for a physical illness.
Absolutely. It's something that I notice quite a lot in conversation with people. People will use the term mental health when they mean mental ill health or poor mental health, when in reality, you can have good mental health as you can have poor mental health. It's
Yes.
something that everybody has.
And in a sense, you can create good mental health as well. We know that our mental health is determined by what happens in our lives. It's not about us as characters. It's not, there's a little bit of it that's probably biological, but the vast majority of it is about what our lives are like, what we experience, how we're feeling, our life circumstances, the things that are putting our mental health at risk. Are very often the things that are happening to us in life. So it's very kind of socially constructed in that way.
And it can change somewhat day to day, can't it?
Very much so, yeah. You can move up and down that spectrum in quite significant ways, depending on, for example, if you have a major traumatic event in your life, you can suddenly have a very sudden deterioration in your mental health. Likewise, if your life circumstances improve significantly, then you can see quite significant boosts to it. So yeah, we're all going up and down. And unfortunately, we know that it's not equally distributed. So some groups of people and some people will have much better chances of good mental health than others.
Which takes me on to the need for more mental health support that we identified from our most recent report, the State of Cardiomyopathy Care, which was off the back of our national survey, our most recent national survey, in which we asked some questions about people's mental well-being. And there was a stat that really stuck out to me, which was that more than 50% struggled to cope emotionally over the last 6 months due to their cardiomyopathy, which suggests that there's lots of people out there with cardiomyopathy who are not having a great time in terms of their mental health.
Yeah, it's. I mean, these are shocking figures, aren't they? And obviously, for people living with cardiomyopathy and family members, they won't be shocking at all. But when you think about this in the broader sense, we often use the cliche in the mental health world that there's no health without mental health. If you haven't got good mental health, you're not enjoying good health because it's such a significant part of your life. It can have such a big impact on your life. That if you are struggling to cope emotionally, then you haven't got good health. And that's something that is deserving of and requires support. And I know that's what we're here to mainly talk about today is what that support ought to look like if it were designed properly. But these are very, very stark figures indeed. And it's fundamentally important that the powers that be take notice of this.
I think also that in terms of from the figures, but also from the text there. So this quote about I live alone and I get very scared about my condition and how to cope with it. Also, I feel anxious a lot of the time as I never know what will happen next in my body. It's that not knowing. And also in the next slide, there's another quote about someone finding it hard to not do what they used to do. Such a huge change with cardiomyopathy, and my close family find it hard too. The impact on carers hugely important. I try to be philosophical and appreciate what I can do, though. So that's that bit about that you talked about, Andy, in terms of what people can do in terms of their mental health and perspective, I suppose, how you framework things. It's difficult when out and about. Some disabilities are hidden, so it's what people think of you as well.
Yeah, that's right. And again, our mental health is about our lives. It's about, the way we live, the things we can do, the things we can't do, the way we experience our lives compared to other people's lives. And it's fundamentally kind of important that we support people's mental health and well-being, so that if you do live with a physical illness that's significantly life-limiting or brings very significant risks with it, that we're providing emotional and psychological support alongside that at every single step from the very beginning all the way through.
Yeah, absolutely. And just looking at that stat at the bottom there, in terms of support, 60% are struggling to cope, 28% wanted access to counselling on loved ones, but and 46% of people with cardiomyopathy wanted access to counselling. So there's a lot of want for counselling. I think people know that they clearly know they need support and they want that support, but at the moment, too often it's not there.
Yeah, and I mean, this is what in mental health services would be described as unmet need. So it's people who clearly need a service, and it's not being offered or not there, or if it is offered, it may not be as successful for a number of reasons. So certainly in the research we've done, and I'm sure we'll talk more about that later. Even when people do get access to psychological support, it's not always successful or effective. Sometimes it is, and it's great when it is, and it can make a massive difference. It really can be transformative in people's lives. But it does need to be tailored to the needs that people come to it with.
And there's and in terms of sort of, because people with cardiomyopathy, obviously it's a long-term condition, and it's really hard, but there are lots of long-term conditions out there that are, also hard to live with. So to what extent do you think that cardiomyopathy, people with cardiomyopathy have needs that are similar to people with other long-term conditions in terms of their mental health? Or to what extent do you think it's different and standalone? Because presumably mental health services are only ever going to be geared up to meet the needs of smaller populations like people with cardiomyopathy to a certain extent. Whereas actually, if you look at it in terms of being everybody with long-term conditions having mental health needs, presumably, then that's a different kettle of fish.
Yeah, I think it's really interesting about where we go with this. So the research tells us that if you live with a long-term condition of almost any kind, your risk of experiencing a common mental health problem is roughly double the rest of the population. So that's a quite significant increase in risk, isn't it? And so therefore, anyone with a long-term condition should have easy access to support for their mental health, no matter what that condition is. But what we know when we've talked to people with a wide range of long-term conditions is that it's important that support understands what it's like to live with the particular thing or things that they're having, because of course many people have more than one long-term condition at the same time. And so you'll have lots of different types of experience if you have cardiomyopathy and another condition alongside it, which may be related or completely unrelated. That affects the kind of support you need for your mental health at the same time. So I think it's again, there will be particular elements of cardiomyopathy that bring particular challenges to mental health. But I think when we look across all long-term conditions, similar themes do tend to emerge. So coming to terms with having a long-term condition which may limit either your life expectancy or your ability to do things, to live your life the way you used to or would like to. The age at which you first experience something or know you have it can have a big impact. You know, something that you first experienced as a child could be very different to something that you first have in middle age or later life. That's not to say one or other of those is better than the others, but just that the experience is different. And so people's stage in life is important to how it affects their mental health. And indeed, you know, the extent to which a condition is progressive. So if it kind of stays roughly stable, or if over time your needs change, your physical needs change, that can have an effect on how you experience it, and indeed whether you first experience it in a traumatic way, with an acute episode that might include going to hospital and being very severely unwell, or if you find out you have a condition but aren't necessarily ill with it straight away. And of course, for people with cardiomyopathy, you'll have a whole range there from very traumatic finding out you have it through to learning about it through screening and not actually being unwell at the time, or indeed living for quite a long time without being unwell but knowing you have it. So again, these all bring very particularly different experiences, and I think it is a reasonable expectation that mental health support should be provided with that understanding.
Absolutely. And just to draw out what you were saying about the stage in life, and people with cardiomyopathy, I think there's also something quite particular around genetic screening and impacts on family relations. And I think for in terms of children with cardiomyopathy, I wonder whether, you know, growing up with cardiomyopathy, it's not something they've had to get used to in the same way. But for their parents, however, knowing that they've potentially handed a genetic condition to their child, which may, you know, have an impact on that child's life for the rest of their life, there must be a huge impact. And so that thing around family relationships being impacted, and I think that's probably particularly the case with cardiomyopathy because of the genetic element.
Yeah, I think that's exactly right. And you know, it's qualitatively different to something which happens during your life, and so understanding that is fundamentally important to offering people the right emotional and psychological support. And again, for all the family members, they'll have a different relationship with it depending on how that diagnosis has come about and whether they're a member of the family who don't have it, but you know, as the survey showed, still could benefit from some support for their mental health. So your relationship with it is going to be different depending on where that's happened within your particular family circumstances.
Absolutely. And something that we didn't do in relation to these statistics is actually break them down in terms of people with different, people in terms of how long it is since their diagnosis, because I think that probably also changes. And going back to that life stage thing, there'll be different people's mental health needs will presumably change as their illness advances as well, because I know there's, you know, it's a particular life stage for people who are in the advanced stages of heart failure, and even you know, palliative care or end of life care can be, that's also, you know, there will be mental health needs attached to that, right?
Yeah, absolutely. I mean, yesterday was World Mental Health Day, and the theme of this year's World Mental Health Day was mental health as a universal human right, which of course we fundamentally agree with. You know, that there is no excuse for overlooking and ignoring people's mental health and well-being, and that's at every single point in your life. So from childhood through to later life, and indeed if you're reaching end of life, you still have a right to be supported with your mental health and to enjoy the best possible well-being,
Mm.
even despite the many challenges that you will be experiencing at that time. And so if we take a kind of rights-based approach to mental health, rather than seeing it as something which is an add-on, if you like, a kind of luxury extra. And I think for too long, health services have seen mental health as being a bit of a kind of side issue, not
Mm.
really as important, doesn't matter as much. Actually, we know it matters hugely. If you have poor mental health, it makes it much harder to look after your condition and to look after yourself and stay well physically. And of course, you're not enjoying good health if you don't have good mental health.
Absolutely. It's that whole person care, isn't it?
Mm,
It's
mm.
not indeed sort of getting to the point where we don't necessarily kind of separate things out in that way and see people as a holistic individual, right? Because these things impact each other as well.
Yeah, well, very much so. Once you see people as a whole person, and you think about, well, what kind of support do you need, and that includes, for many people, the challenge of living with a long-term condition is also financial, and it's about relationships. So it's about things other than your health and well-being. It's about the practical elements of living with that condition, maybe having to change your working life, maybe having changes in your family relationships, in your social life. Um, Many people, of course, living with long-term conditions over the last 3 years or so have felt particularly isolated when people have been asked to shield, for example. And so there are numerous ways in which we need to kind of understand the links between mental and physical health. So again, it's about seeing that whole picture and providing support to the whole person rather than just seeing an individual as a set of symptoms, a heart with a person around it.
And do you think that health services are moving in that direction?
I think we're beginning to see it. Um, we've got a long way to go, but we're now at least more conversant in mental health. We're happy to talk about mental health a bit more. Again, from slow beginnings, but we are getting there. Um, the NHS is trying to expand its mental health offer and extend it, and we've got a long way to go. You know, there is an enormous amount of unmet need out there in the whole population.
Mm.
Um, so we are beginning to make progress, but we really are at the very beginning. I would hope that in future, when we look back on where we are now, we think, goodness me, we did not do a lot for people's mental health then, did we?
Mm. Yeah, because we want to get to a place where the offer is so
It's
transformed.
just normal and routine and regular, and it's a part of the support you get for living with a long-term condition
Mm.
is support with your mental health, just as standard. That's what we should be aiming for. People deserve nothing less.
Absolutely, no, completely agree. So I wonder whether that takes us on to sort of the next stage of our webinar, having unpacked the issues a bit, talking about some of the changes to get to that end state of amazing, well, not well, hopefully amazing, but just the normality of mental health being well catered for. What changes do you think that are needed? How are we going to get there, Andy? Tell me, tell us.
Well, we don't have all the answers yet, but the research we've done, and we've done a number of pieces of research, both across a range of long-term conditions and particularly with some. We haven't yet done research specifically about cardiomyopathy, but that is hopefully something that Cardiomyopathy UK will want to take forward. But I think what we know is really we need two very significant changes if we're going to have whole person care for people living with this condition or these conditions. The first is we need to ensure that the people working with you are mental health literate enough and have enough time to have a conversation. One of our reports we produced was called Ask How I Am. And it came from people with long-term conditions saying, I wish my clinician, my consultant, the nurse, the GP would just ask me how I am and mean it. And in a sense, that's something that should happen at every interaction with the system, that people just inquire, how are you doing? How are you feeling? And actually, of course, that's a challenge if they don't have the time to have that conversation, if consultant appointments are rushed. If you've got a system that's working under the kind of pressure it is now, that's really challenging to do. So this isn't just a kind of, well, we just need better clinicians argument. This is about we need to change the way services work so that the people working with you have enough time, have enough knowledge. They don't have to become counsellors or psychotherapists. They just have to have enough knowledge to check in with you, maybe to offer a little bit of help and advice, maybe to have a little bit of a conversation. But of course, the second part of that is we do need tailored mental health support for people living with long-term conditions. And again, all long-term conditions. That may mean, for example, having a mental health worker as part of your multidisciplinary team. We've got all sorts of people who provide care to someone living with cardiomyopathy. Maybe in future that should include mental health workers who can provide a range of psychological interventions. And that can be everything from very early help to manage your well-being, kind of help and advice, some of which could be digital as much as in person, but also tailored support where people need proper kind of therapy done by people who have the requisite skills and knowledge to provide that. So a range of mental health interventions. This isn't one where there's just a single thing that will work for everybody. People's needs are inevitably and inherently different. But the one thing we hear consistently when people have experienced a psychological intervention is it's much better if the person doing it has an understanding of your long-term condition. That seems to be really fundamentally important. So right now, anybody can go to their local NHS talking therapies service, no matter where you are, certainly across England, and refer yourself or get a referral through your GP for talking therapies. And that's something that's only been the case for a few years now. It's a major development across the NHS. So anybody can do that. But of course, it's unlikely the person who sees you will have an understanding of what cardiomyopathy is and what living with it is like. So it's really important to say there are talking therapies out there. They are available. Absolutely. But we need more than the kind of generic service for people living with this particular set of conditions.
So just to pick up on a couple of things you've said, going back to the issue of sort of, the Ask Me How I Am campaign, the what's needed from clinicians to ask people how they are and to mean it. I had an interesting conversation with a neurologist a few years ago about this, and I was basically asking him why don't healthcare staff always ask people how they are? And he's talked about how it was basically that he saw it as opening a can of worms, which was worrying. But he said basically, unless I've got somewhere to refer people on to, then I've got nothing for them. So I'm asking them to open up to me about their mental health. But unless the system's working and I've got onward referral routes, what can I do for them? But also, I think there was an element of him being upskilled enough to feel happy to have those conversations. Because I mean, these are the term can of worms about someone talking about their mental health. Slightly problematic in my view. So there's that upskilling element, which also then links in with what you're talking about with mental health care staff knowing a bit more about individual conditions. I think we probably need to get to a place where you have mental health specialist staff who are specialists across different conditions, but we also I think need more research into what sort of psychological therapies maybe work for different conditions. So I think there's been a lot going on, but I don't know yet whether there's been any particular research into, because there's lots of different psychological therapies out there, right, Andy? And the standard talking therapy services tend to offer CBT, cognitive behavioral therapy, with some other add-ons. But there are so many, there's a huge range of mental health treatments and therapies and actually understanding which ones are better for which long-term conditions?
There's a huge range of psychological therapies, and as you say, the NHS offer is generally CBT, which is a relatively short, very kind of focused on the present type of therapy. For about half of people who have CBT, they find it helpful, which is good. So it's a good treatment. It's short, it's quick. It's quite inexpensive for the NHS, but for many people it has huge benefits. The other thing to say is it won't just be the long-term condition or conditions you're living with. It will be many other factors that will determine what kind of therapy you might find helpful, because of course nobody comes to this without other life circumstances. So if you are living in poverty, for example, insecure housing, that can be an extra challenge that can make a difference. Your experiences in life prior to that, certainly, there are lots of other risk factors for poor mental health that go right back to childhood that will have an impact on what kind of psychological interventions might be helpful. So in a sense, we need a wide range, and yes, we need more research, but we don't want to wait for research to do something. And in some ways what we need is a system which is really responsive and provides a range of support for people, and don't wait for a kind of diagnosis of depression or anxiety to offer help. But yes, I think that we're kind of getting onto the phrasing that was used, I think, takes us into the fun territory of stigma, doesn't it? Because it is still difficult for some people to talk about mental health, and particularly health professionals. There is often quite a kind of culture of denial around mental health, if you like, among health professionals, a difficulty dealing with it as an issue and feeling comfortable and conversant in it. So that is, of course, where there is a kind of education and training solution. It amazes me that you can become a health professional and know nothing about mental health. There isn't a single health professional anywhere in the system I can think of, or indeed person in the system, the folk who meet you in the waiting room and see you at any part of the system, need to have a bit of knowledge around mental health. And this should be just normal. This shouldn't be exceptional. It should be part of everybody's training and continuing professional development too. We really can't have excuses that oh, well, my specialism is this, so I don't really deal with mental health. I think we have to get to a point where that's no longer good enough. And as you say, we also need mental health professionals who have an appreciation of what living with a long-term condition might be like, and the effect that will have on your mental health and well-being. We need a meeting in the middle, don't we?
Yeah. Yes, and it feels like the cultural change from 30, 40, 50 years ago, when mental health was very much perceived as, men in white coats, something we don't talk about, something to be deeply ashamed of, to us doing this webinar today, obviously we've come so far, but yet there is so far yet still to go, and the change within the health service that you're talking about, and that becoming so normalized and such a normal part of any training pathway, we're just not there yet. And so hence, going back to those statistics, that's why we're still seeing such high statistics in terms of need that isn't being met by the health service at the moment. And just to pick up on something else you said, in terms of the different sorts of therapy, and what we were talking about life stages, I wonder whether there's also something about that kind of prevention piece at the point of which someone is diagnosed, because at the very, very point that you're diagnosed, you might have, you might have particularly great mental health, yet the diagnosis can have such an impact on people. So, trying to put the mental health support in, that even at diagnosis, people are supported with that diagnosis such that their mental health isn't as badly impacted, maybe. Sorry, dig on.
No, I think that's exactly right. I think what we know is that very often somebody living with a long-term condition, or indeed anyone, might have 3 or 4 goes at asking for help for their mental health because they don't quite feel confident in asking. They're not sure whether they're going to get a helpful response from the health professional they're seeing. they might go in with a physical health problem and feel shut down or unable to raise something else, particularly if they feel like their consultant's in a rush and terribly busy. So this is where we need proactive approach. People need to be properly asked again at every opportunity, and particularly at major transition points. So when you get the diagnosis, for example, if you're kind of having any changes in your condition, if a family member is having a diagnosis, these are all points where there is a heightened risk. The one thing we know is that all our journeys are different. So when someone's mental health might be affected may not be the same as someone else. So you can't just only do it at diagnosis point or only do it kind of at particular kind of moments. But there are clearly times when someone could particularly benefit from it, and the aftermath of a diagnosis is undoubtedly one of those points.
And I suppose the support on offer, it doesn't need to be, full on mental health therapy. There's things like peer support can be really transformative for people, can't it? And then I should say at this point that Cardiomyopathy UK does have peer support groups. So I hope that everybody listening are aware of those. And if not, do take a look at our website, because I think it is something that's really important for people.
Yeah, again, a range of different approaches. So psychological interventions are great, and for many people can really change their life. For others, actually, there are other things that are more helpful, and sometimes actually just being helped to deal with your finances. If your biggest presenting worry in your life is how you're going to have enough money coming in and afford the rent, that's the thing you need support with. That's the thing that will probably improve your mental health more than anything. Support with family relationships and other social needs. These are things which can make a very significant difference to people's mental health and well-being. So it is about a range of interventions, some of which are very, very low cost. These are not things that are going to cost the health service an absolute fortune to do, but they can bring about very significant improvements in someone's mental and then, because of that, physical health.
Yeah, absolutely, because the two are so linked. As I think someone in the chat mentioned a minute ago, the impacts of mental health and stress on the heart. So looking at the time, much as I'm sure you and I could talk forever, Andy, we did say that we would do a Q&A. So I wonder if there are some any questions in the chat that anyone wants to type in just as we're speaking now. So there was a comment about mental health, good mental health having a direct impact on the health of the heart, especially a diseased heart, whereas stress aggravates arrhythmia. So why is mental well-being often treated as a bolt-on?
Yeah, obviously all I can do is agree with that point, really, and just reflect on how important that is, because of course, again, if the system worked well, you would be supporting people to have the best mental health they can in the circumstances they're living in, and there are enormous challenges to living with cardiomyopathy. So I do think it's really important that is done again proactively, rather than kind of waiting for problems to occur, which then make the physical condition a good deal worse. I mean, again, this is something we see across all long-term conditions, that actually poor mental health makes your physical condition worse. And actually proactive support for the emotional and psychological part will also then have very direct physical benefits. And again, there are reasons we're only just beginning to understand for why that is. But it's very clear that poor mental health is a trigger for poor physical health. There was some recent research, for example, that showed that depression is a risk factor for type 2 diabetes, which we didn't know until recently, but it's actually an independent risk factor for it. So yeah, there's a lot more we need to know. But again, that shouldn't stop us going out and providing support right now.
For some people, poor mental health actually manifests physically, doesn't it? Particularly, I suppose, not just thinking kind of in white British communities, but I think I've certainly heard that in different places around the world, physical manifestations of mental health are often more common. I've just seen, sorry, there's another couple of questions in the chat, so I'm going to go with both at the same time, if that's all right, Bill. Andy, sorry, I'm reading someone's name, and ask you to respond to both. So Bill says, living with DCM, he feels his wife is also living with it, which leads to guilt on his part. And he's about to start reading a book about the expectation effect and how your mindset can transform your life, which he thought might help, which sounds a bit like CBT. And then got a question from Alison. Are there red flags in how you feel that should prompt a discussion with a health professional? So I'll take those two.
Yeah, great points and questions. And again, I'm not a clinician, so I'm not going to offer clinical advice. That would be stretching my knowledge. But I think it's really important to say that if your mental health isn't feeling right, if you're not kind of feeling the same as you were, if you are kind of experiencing particularly emotional kind of difficulties, not sleeping is often something which is a kind of can be a sign, or just not enjoying things that you used to enjoy as much, then I think it's always worth having a conversation. While we know there are limitations in the support that's available, I think it's really important that if you feel like things don't feel right, then it's important to say something. And obviously it will depend on what help and support is available locally, but there are also great self-help resources available online too. And clearly Cardiomyopathy UK has lots of resources available. There are other mental health charities that provide advice and support too, like Mind. So again, looking for support that's available. If you have access to the online world, then that can be very helpful. But talking to a health professional about it, again, the more people ask, the more the system will have to respond. So I think asking for help is a really important first step, and it can be a quite kind of daunting first step. But again, one of the things decision makers need to hear is that there isn't just need, there's demand.
Absolutely. So I'm very aware of time. I think we've had a few comments in the chat, not particularly questions. So just to skate over it very quickly, someone saying about how their stress has stemmed from a lack of adequate information and support from medical staff, which if that improved, then the mental health would improve. And there was someone else talking about agreeing that the constant financial anxiety brings on other anxiety, with what might happen in relation to their health condition. Because you've got the financial anxiety, then knowing what's going to happen with your health condition, and the interaction, I think, between these things. And then also someone talking about how a recent spell in hospital resulting in anxieties around not the impact on their husband and children. So it's those family relationships again. So I think I'm going to take us to the end, because we are at our allotted finish time, I believe. So I just wanted to thank everybody so much for coming, and thank Andy very much for joining us as well. We hugely appreciate your time and expertise, Andy. It's been lovely having you.
Thank you very much. Thank you for having me.
Just to say to all of you on the call, that if anybody has been triggered, again, here's our nurse helpline. Please do give them a call. They're not mental health nurses, but they have had training and will be able to support and signpost you on to other services. And then finally, just a flag that in terms of our work around mental health, so we do have an ongoing area of work. We're part of a long-term conditions group of charities who are trying to influence better provision of mental health, and Centre for Mental Health sit alongside us on that. So we are doing influencing work to government to try and improve the situation. But we're also still at Cardiomyopathy UK gathering our understanding and evidence to input into that influencing work. So next year we'll be doing another survey, a biennial survey, as the one I flagged at the beginning, which will ask questions about mental health. And alongside that, we're hoping to do an evidence gathering workshop with people who are interested in telling us more about their experiences of living well, of mental health, what their mental health's like alongside their cardiomyopathy. So if you are interested at all in participating in a workshop next year, talking about mental health, there's an email address there, research@cardiomyopathy.org. Do drop us an email and we can add you to the list for when that does eventually happen. And also you can potentially join our mailing list, and where we email people about opportunities, because sometimes things come up in relation to mental health as well. So with that, I shall end here. Thank you for everyone. Thank you, Andy. Have a good day, everybody. Goodbye.